So how do the drugs get into hair? Well, the honest truth is no one fully understands how drugs get into hair. We know that there are a number of mechanisms that are involved in drugs getting into hair. And the most important one in terms of assessing someone's lifestyle is actually incorporation during the formation of the hair. As you can see from this slide, we have here the blood supply along the bottom. Any drugs that someone takes enter the blood. That's exactly how they have an effect. That blood supply feeds in, as you can see these very narrow vessels, into the base of the hair follicle. So then the cells that are formed in the hair at the time that blood is supplying it that has the drug, then those drugs become incorporated into those cells that form in the base of the follicle. As more cells grow behind it, now without the drug, hopefully, if we're not talking about a regular user, then the band moves up. And if we think of this as a band of drug, they developed there, these new cells are formed behind, and that's the drug area moving up the shaft and giving us this record coming out above the scalp ultimately. As you can see, there is some distance there, and that is important that the hair is below the level of the scalp and needs time to grow out when we're talking about cut samples and timing. And again, that's a point that I'll revisit later. But there's also, as well as the formation of hair, there's issues that the drugs can become incorporated from sweat and from sebum, which is grease that lays down on the hair. Now, in some ways, that's not a problem, because if they were in the sweat and the sebum, then obviously the person took the drug. But that still does cause problems when you want to look at timing, when you want to look when a drug was taken. And this is another factor that has to be taken into consideration later on. If we're talking about very young children, there's also an issue about drugs coming from maternal blood. Because if the mother is using drugs and we have a very young infant, then the hair is formed in the last trimester of pregnancy. So hair that is seen in a very young child may not represent anything being given to the child in life. It could be that it came from use by the mother during pregnancy. And sometimes that can be useful to show that it is present in a child from the pregnancy, but there are sometimes instances when you actually want to investigate, was this drug administered to the child during life? And very careful consideration has to be given to that possibility. In addition, it can come from the environment. When drugs are smoked, I'm sure in the days when smoking was allowed in pubs, you've gone home and you could smell smoke in your hair. Well, drugs that are smoked in the same way that smoke from tobacco can contaminate the hair, so can smoke from the drugs that are smoked. That's predominantly things like cannabis, heroin, and cocaine. And those things have to be considered in the interpretation. There are ways that we can look at later that allow that to be distinguished, but all of those factors have to be considered because all of them do allow drugs to enter the hair.